Hi everybody, my name is Tobias, and I'll talk about how to design assistive technologies for the ADHD domain. And why is this interesting? So primarily because of two things. So first, there's been done very little work for HCI within this domain. And second, I think we as designers, engineers, psychologists and so on are in a unique position to create assistive technologies that can actually empower these children. So I have an interdisciplinary team, so I am a computer scientist myself, and I have two co-advisors from the Department of Public Health and Clinical Medicine. And I also work together with a center called Center for ADHD, that's a parent training program, where I've been taking care of the parents when they come in to get parent training. I've been taking care of the children. And I think that's important for all of us when we're trying to address a new domain or assisting people with various deficits disorders to collaborate with experts within that domain. Because in my computer science education I didn't learn anything about ADHD. So what will I talk about? So I'll first give an introduction to what ADHD is. Then I will just briefly introduce the studies we're based on, and then I will come with 6 challenges that children with ADHD suffer from, because I think that's important when we as HCI researchers are designing for this domain to understand our users. And then I'll talk a little bit about lessons learned, and if we have time I will come with some of the examples of projects we have made and some ideas for projects. But I plan to keep to the time, so we might not use it. So what is ADHD? So ADHD is an abbreviation for Attention Deficit Hyperactivity Disorder, and it affects approximately 5% of all children worldwide, and it's associated with a lot of negative effects such as social and academic challenges, increased risk of criminal convictions in adulthood, and also it negatively affects the quality of life. As you see on the last bullet up there, it says that one study found that 70% of all children with ADHD in the 3rd grade report that they did not have any close friend in the 3rd grade. So I think that's one additional argument why we should design for this domain. The traditional treatment for ADHD is medication. And that is pretty effective, but it doesn't solve all the challenges, so I think there's still room. There's also, as I said, parent training is beginning to become more and more used, because we still don't know the long-term effect of using medication for these children. Also, there's been, related to our field, examples of cognitive training programs, and also neurofeedback. However, most of these studies has been done in a lab, and there's not really been enough users in the studies, and there's not been a standardized way to report these studies, so it's hard to say if there's an effect of these or not. Again, that begs for more research. So I'll highlight most of the research done within this domain from HCI. Pina et al. Did this system called Parent Guardian, which I would have wished that I had made. It's a brilliant system that uses parent training techniques. So the parents are wearing a wrist-worn device that can detect stress, and when they are getting upset or stressed, then their phone will vibrate and they will see this message, or the iPad on the wall will show this message that you are a role model for your child. What do you want to teach? So in some kind of way, reminding them to use these behavioral parent and techniques to avoid yelling at the child. Another example is Tankipan by Weisberg et al. And it's still a paper prototype. I think maybe they did a 3D model of it also, but it helps the child in the morning to remember the activities going through. So that is primarily what's been done outside the lab. So yeah, it's been done a lot of on dyslexia, autism and so on, but not that much on ADHD. So what do we base our findings on, these challenges and lessons learned? So, as I said, I've been having more than 50 hours of hands-on training taking care of these children. At Center for ADHD, I've been following child psychologists and psychiatrists when they have been diagnosing children with ADHD. Been in 7 or 10 schools, I think, and observing their behavior, how teachers address them, and the teachers' concern. And then we have done a couple of research projects also within this domain. So let's just jump to some of the challenges that we as researchers should be aware of, or should know before we design to this domain. So first of all, children with ADHD has a very hard time remembering a sequence of instructions. And remembering a sequence of instructions rely heavily on the working memory. And like existing research has already shown that there is a connection between ADHD and working memory deficits. And the consequence of this deficit also causes the parents and the teachers to have to remind the child constantly what they're supposed to do, which again causes stress for the parents, which again will harm the child in some way. So transitions between one activity to another is the number one thing the teacher said was the biggest problem when you had children with ADHD in a school class. And one mom said that for a child there can be 1,000 inputs on your way. You always have your antennas out, so you cannot focus on the task originally planned. And for example, when a child in a school has to go pick a book from a shelf or something, there can happen a lot of things, and this often causes conflicts and disturbance in the classroom. Another thing, of course, a core deficit in the ADHD disorder is sustaining attention. And from our studies, we learned that even like small noises, for example, a bird flying into a window or just water running in the pipes, could cause the children to forget about what they were doing and forget about what they were doing and sit and begin to do something different, which often would result in impulsive behavior. That's also been reported a lot in psychology, that children with ADHD often have a higher degree of disruptive and off-task behavior in the classroom. And we also saw that in our studies. One more thing is that children with ADHD have a hard time perceiving time. And this deficit can cause the child to lose focus on what they're doing. And again, when they lose focus, they begin to have this disruptive and behavior. So that's again something that we as researchers maybe could address in some way, design technologies that actually reminds them or show them how much time there's back for the class or something. And the last thing is bedtime resistance. So that might sound strange, but as sleep is really important for a child's neurofunctional behavior. And even a 1 hour 1 hour sleep restriction over 6 nights can manifest in increased hyperactivity, inattention, disruptive behavior, and causes also impacts also the school performance in a negative way. And that's just 1 hour sleep restriction over 6 days. Furthermore, like existing research, so also the parents say a lot of the parents have challenges getting their child to bed because the child have this unease in the body, so they can't fall asleep, which is also documented in the psychology literature, that children with ADHD has a lot higher bedtime resistance than children without. Again, an interesting thing for us as researchers to work at. So I think that knowing these challenges are really important when you want to design for this domain, as they can both guide the development. So, for example, taking care that we visualize time in our applications, but it can also spark ideas about interesting technologies that can be used for this domain. There's been a lot of interesting talks that have easily been able to transfer to the ADHD domain, where it could probably also do a lot of good things for the children. So, let's talk about some of the lessons learned we learned for these studies. So first of all, we saw that especially in classrooms and in the home, parents and teachers used pictograms to maintain structure, structure and pictograms to maintain focus for the child. So this is from a classroom over there, and a special classroom for children with ADHD. And visualizing the structure for the day helps the child to understand what am I doing now, what I'm supposed to do afterwards. Because as I said, they can't have that many informations in their head at one time. So being able to look at some certain place and then they know what they are doing or what they're supposed to be doing and what they should do afterwards could be a great help for these children. So therefore, we suggest that when designing assistive technologies, it is beneficial to do it in a simple and structured way. It shouldn't be too hard for the child to use the application or the technology. And it should really be intuitive so that the child knows what to do afterwards, as they can really fast lose focus from the system. We saw that also in schools where children were using technologies designed specifically to help children with ADHD, but because they were too complicated or there was too many steps before they could get to the next transition, then they simply didn't use them because the children didn't use them. Another interesting thing, which we also know from psychology and HCI in general, is that rewards can positively affect the behavior of people. However, children with ADHD is especially rewards can really influence their behavior. And that's also why in the classroom and in the home, children with ADHD is often rewarded for good behavior. Or if you want to encourage a specific behavior, then you say you can get 1 star if you do not do whatever, I don't know. Therefore, it should also be an idea to include rewards when we design systems for these children, because both as a motivator, but also to encourage the effect we want to achieve. I'll give an example later on. And the last thing is an interesting thing also, like the bedtime assistant, is that a mom told us that she thought that the child were more responsible and they felt some kind of interest and responsibility for using technologies. And again, I remind you that there's not that many technologies that is designed for this domain. And again, that the children really feels more responsible and feels like they are like adults, or that it has been designed something specifically for them, really encourage them and encourage the use. So, I still have a few minutes, so I think I'll give you some examples of what we've been doing. So I would like to present CAST, which the goal of CAST is to objectively monitor activity and physiological activities. By using machine learning, we wanted to see if we could recognize a subset of characteristic movement, ADHD movement behaviors. And what I'll talk about now is to investigate the possibilities for assisting children with ADHD in situ. And what we are trying to attack, the challenge we're trying to attack here is that children with ADHD can't sustain their attention. So we try to help them regain their attention. So we did several studies of this with both children with and without ADHD. As children with ADHD is a vulnerable group, then we often do our studies with children without ADHD first, to make sure that we have all the requirements right. So, we used accelerometers. We also used an EEG headset, but we didn't really use that with any of the children with ADHD, as we didn't want to stigmatize them. We just wanted to see if we could use the data for something. We also used a heart rate monitor to get heart rate and heart rate variability. And then the assistive intervention is based on a smartphone application. And I thought you might as well learn a little Danish while you were here. So the one to the left is in Danish, so it just said, what is, and then there's a question. Then the child has 4 answer options. So it's a simple quiz game where the child is rewarded each time. And then the last screen is the determination screen that says, so we provide the structure here. The game is over, put your phone back in your pocket and return to your task in front of you. So, should be a video here showing the system in use. So on the left you see a child with ADHD, and on your right you see his activity. And for the last 5 minutes, he's been like turning around at his chair, not really doing anything. And it's double speed, so it looks a little dramatic. So now the system says, okay, we don't think this child is actually concentrating now. That triggers the application in his pocket, and he gets this quiz screen. And prior to this, we have not told him or instructed him how to use this. So we just said that it might vibrate, and if it did, he should just take it out of his pocket. And now it says, put the phone back in your pocket. The game is over, put your phone back in your pocket, and return to an assignment in front of you. We can keep looking, but so what happens here is that for the next 12 minutes, this child is active has the lowest activity level in the class, which is 1 hour and 45 minutes, I think. And we also see that it's the duration he actually has the longest on-task activities. So yeah, that was CAST. And we tried to help the child regain his attention. And I can see that I've used 16 minutes now, so I think I will go through my ideas for future work and just take any of your questions if you have any.